Dehydration is a serious condition and should not be taken lightly. Dehydration happens when there is not enough fluids in the body. It can happen very quickly when a child is sick. It can happen when your child has vomiting or diarrhea or both. It can also happen if a child has mouth sores or a sore throat and is refusing to take any liquids. It can also happen in hot weather or when the child is very active. In this video, we are going to talk about the signs and symptoms of dehydration, how to treat it at home, and when should you worry and call your doctor. Hi, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Dehydration in kids. So what are the signs and symptoms of dehydration? In babies who have a soft spot on top of the head, it appears sunken. The eyes may also appear sunken as well. There are few or no tears when crying. The mouth feels dry or sticky. And also the child is cranky or irritable. The child may also be dizzy or drowsy. And there are fewer wet diapers or the child is not peeing enough. How to treat dehydration? Well, the treatment for dehydration would depend on how severe it is. For a child with mild dehydration, you can treat at home by giving extra liquids. But if a child has a severe type of dehydration, the child may need to be brought to the ER at the hospital. Now, mild dehydration can be treated at home with oral rehydration solution. It contains the right amount of water, sugar, and salt to help rehydrate your child. Oral rehydration solution or ORS can be obtained without a prescription at any pharmacy or drugstore. If you can't get a hold of it, talk to your doctor about it. How to treat at home? Now, if your child has mild dehydration and your doctor says it is okay to start treatment at home, what you can do is to give your child small sips of oral rehydration solution or ORS every few minutes. You can give 1 or 2 teaspoons. Now, for babies, you can continue to breastfeed or give formula as often as they want, as long as your child is not vomiting repeatedly. For older children, you can continue on their regular diet and supplement by giving oral rehydration solution. Now, your child may not have the appetite or may not want to take solid foods. That is okay as long as he or she is still continue on drinking, especially the oral rehydration solution. For babies, do not give plain water. Instead, give the ORS or the oral rehydration solution. This is because plain water does not contain the right amount of nutrients to help with your baby's dehydration. For older children, do not give sodas, sports drink, or concentrated juice. This is because this contains a high amount of sugar and can make it worse. Now, if your child is starting to feel better and the appetite is back, he or she will eat more solid food and more of the regular diet. At this time, you can decrease the amount of the oral rehydration solution that you're giving to him or her. And also, do not give medicines for vomiting or diarrhea unless it is recommended by your doctor. Now, when should you worry and call the doctor? You should call the doctor if your child has not been drinking for more than a few hours, if your child continuously vomits for more than a few times in 24 hours, if your child's vomit appears bright green, red, or brown in color, if your child is refusing to take any food for more than 3 days, if your child is not getting any better, And if your child has signs of dehydration such as dry mouth, sunken eyes, sunken soft spot, and fewer wet diapers. Now, if your child is sleepy or drowsy and not responding to you, bring your child immediately to the ER. We can prevent dehydration. So how can you do that? When your child is sick, you can give extra liquids or oral rehydration solution. You can give small amounts, but do this often. Now, if your child is physically active, you can give your child extra liquids before playing and every 20 minutes during physical activity. Also, your child needs to take extra liquids, especially in hot weather. Hey, if you like this video, watch my other videos where I teach you about other child health problems.